Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. I am so excited to introduce to you my newly launched electrical appliance online store. It has high quality refrigerators, it has washing machines, microwaves, air fryers. It has ranges too. You can basically be cooking on top and you're baking something on the bottom. It also has these 5-in-1 food processors. Please support the work that I am doing on this platform by purchasing any of these items. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda, but in the future, as the business grows, I'll be able to ship to those outside of Uganda.
Please place your order now.
I want to continue the conversation from where we left off by talking about the second healthcare-associated infection, that is the catheter-associated urinary tract infection. The catheter-associated urinary tract infection is an infection in the system that forms urine, and it is usually in a setting of an indwelling urinary catheter, that is, when a urinary catheter is in place or 48 hours after its removal. A urinary catheter is a thin flexible tube, and it is usually used to drain urine from the urinary bladder, especially in individuals that cannot pass out urine normally. The urinary catheter is hollow. It has a passage, a lumen, where urine passes as it is being drained from the urinary bladder to the outside of the body. Majority of the time we collect this urine in a bag called the urinary bag. The urinary catheter has two surfaces. It has the extraluminal surface, that is the outer surface of the catheter, and the intraluminal surface, that is that inside portion of the catheter that is surrounding the lumen, or the passage where urine passes as it is being drained from the bladder to the outside of the body. The urinary catheter is commonly inserted in two areas of the body. The first one being the suprapubic area. When inserted in the suprapubic area, a small incision, a cut, is made in the suprapubic region, the lower abdomen of the patient, and we pass through the different layers of the lower abdomen of the patient, and we make an incision on the urinary bladder and then insert the urinary catheter. The urinary catheter can also be passed through the urethra. Just a side note, we have two organs within our body called the kidneys. We have the right kidney and the left kidney. The right and the left kidney filter our blood and transform it into urine. The urine formed by the right kidney will be transported through a tube called the right ureter, while the urine formed by the left kidney will be transported through a tube called the left ureter. Both the right and the left ureter will transport this urine to another organ called the urinary bladder. Once the urinary bladder is full, the urine will be passed out from the body via a tube called the urethra, and it will exit the body through a small opening called the external urethromeatus. A urinary catheter can be passed into the bladder through the urethra, this tube that connects the urinary bladder to this small opening where urine comes from, the external urethromeatus, such that it can drain urine from the urinary bladder to the outside of the body, and it can be collected in a urine bag. The microorganisms, that is the germs, that are commonly implicated in the catheter-associated urinary tract infections include the bacteria and the fungi. The bacteria that are commonly implicated in the catheter-associated urinary tract infections include Escherichia coli, which is the commonest bacteria that is implicated. We also have Klebsiella pneumoniae, Klebsiella oxytoca, and Pseudomonas aeruginosa. The fungi that are commonly implicated in the catheter-associated urinary tract infections include the Candida species. These are just names that we give to these bacteria and fungi, the germs that cause the catheter-associated urinary tract infections. These bacteria and fungi, the germs that I've just laid out, can come from your perineal region, your groin region, especially if this region is dirty or if there is an infection going on. They can now enter into the external urethral meatus, the small opening where urine comes from, and they can track upwards on the extraluminal surface of the catheter, the outer portion of the catheter, and they can move upwards into your urinary bladder. That is how they can get into your urinary bladder. That is why it is very important for you to keep your groin region, your perineal region very clean, especially when you have a catheter in place. Even when you don't have a catheter in place, your groin region should be clean, because this is where the bacteria and fungi come from to enter your system that forms urine, and then you end up with a UTI. Sometimes the bacteria and the fungi that cause the catheter-associated urinary tract infections can enter through the openings on the urinary catheter, and they can track upwards on the intraluminal surface of the urinary catheter, that surface of the catheter that surrounds the lumen of the catheter, and they can ascend upwards into the urinary bladder. Sometimes the bacteria and the fungi can come from elsewhere in the body, from other systems of the body, and they can be transported via blood and end up into the kidneys, and then they can be filtered as part of urine, and they can end up into the urinary bladder. It doesn't matter how the bacteria and the fungi got into the urinary bladder, they will still cause the catheter-associated urinary tract infections. Sometimes they can even ascend to other parts of the urinary system, for example the ureters and the kidneys, and cause infection there. The bacteria can also go to the bloodstream, a condition called bacteremia, and it can even escalate to sepsis. The individuals that are commonly implicated in the catheter-associated urinary tract infections include the female gender, individuals that have paraplegia, that is paralysis of the lower limbs and the lower part of the body, individuals that suffered a cerebrovascular accident, that is a stroke, also individuals that are elderly, individuals that have diabetes mellitus, individuals that have had an extended catheter indwell time, that is the catheter has been in place for a long period of time, individuals that have a history of urinary tract infection, as well as individuals whose catheter was inserted without adhering to the aseptic precautions, sterile precautions. The signs and symptoms of the catheter-associated urinary tract infections include fevers, that is an increase in the body temperature, chills, that is a feeling of coldness, rigors, that is shivering, especially when the body temperatures are high, abdominal pain, especially in the lower abdomen and the flank regions. There can also be lower back pain, as well as pain at the site where the catheter was inserted. The urine coming out of the catheter will also be foul-smelling and cloudy. It might also have blood and pus. There can also be leakage of urine on the sides of the catheter where the catheter was inserted, around the catheter. If the catheter is finally removed, the individuals will have frequency, that is, urinating many times in a day, more than 8 times in a day. They also have urgency, that is the inability to postpone urination. The affected individuals can also have changes in their mental status. For example, they might get confusion, and this confusion will worsen as time goes on. They'll also be agitated. They will not be rested. They'll be restless. Please, I urge the healthcare providers to be on the lookout for changes in the mental status of any patient that has a catheter in place, because this can be the only presentation of a catheter-associated urinary tract infection. The affected individuals can also present with general body weakness. They will become very weak. The investigations that we carry out in the catheter-associated urinary tract infections include a urine analysis. We can also do a urine culture. The samples for the urine analysis and the urine culture are taken from the midstream of the urine. If there is more than 1,000 colon-forming units per mil on culture, the patient will be diagnosed with a catheter-associated urinary tract infection, especially if they don't have any other conditions that can explain the signs and symptoms that I laid out earlier. When it comes to the treatment of the catheter-associated urinary tract infections, the following can be employed. Antimicrobial therapy, for example, antibiotics and antifungal agents. And these are usually dependent on the results from the urine culture. The underlying condition that caused the patient to have difficulty passing out urine, for example, enlargement of the prostate, a urethral stricture, should be rectified such that the catheter can be removed. However, these operations should be done when the catheter-associated urinary tract infection has been controlled. Until then, the catheters should be changed every after 2 weeks, especially after confirming that the patient has a catheter-associated urinary tract infection. When it comes to the prevention of the catheter-associated urinary tract infections, the following can be employed. The insertion of the urinary catheters should only be done by competent, trained healthcare providers, and it should be done under aseptic precautions, sterile precautions. Urinary catheters should only be placed in individuals that truly need them. Individuals that have medical or surgical conditions that warrant a catheter placement. Please also exercise good personal hygiene. If you have a catheter in place, please make sure that your perineal region is clean, your groin region is clean. This is because when you have a dirty groin region, this can be a source of the germs, the bacteria and the fungi that can cause catheter-associated urinary tract infections. Please also exercise good hand hygiene, especially before and after touching the catheter. Please use soap and water or use an alcohol-based hand rub. That is what I had for you. Thank you so much for watching and listening. Please share, like, comment and subscribe. Also hit the notification bell such that you can get notified whenever I upload a video. Please also support the work that I am doing on this platform by purchasing any of my items from my electrical appliance online store. Please place your order today by reaching out to me via WhatsApp or via a call on my numbers on the screen, and then your order will be delivered to you. Deliveries can be done to all parts of Uganda at a free cost. You don't have to pay for the delivery. But in the future, I'll be able to ship to those outside of Uganda. Thank you so much, and I'll see you in my next video. Bye.